maybe progesterone would be also a good point to mention
Sure.
about baseline. I think obviously saliva would be good baseline prior to progesterone therapy, correct?
Can be. So
Can.
there's an interesting study that just came out last year, like about a year ago. And what they did is they took commercially available
Mhm.
tests and they just looked at 10,000 results and just said, does this match the story that biology tells? And what they found is, as I've described with estrogen, it didn't work. Basically, the assays just didn't have the sensitivity, and the data just sort of falls apart. It doesn't work. Then they moved to progesterone. What they found was really interesting, is that when you look at the blood tests, the results match the biology story. You say,
Mhm.
okay, that's our bar. Like that's
Yeah.
what we're comparing to. And then they move to progesterone and they move to these research methods that are pretty sensitive, a little more expensive if you want to run them. And they found the data matched up pretty well. Then
Mhm.
they took one more step to what's commercially available, which is cheaper, easier, and easier to automate. And what they found is it went from strong correlation to moderate correlation to now low correlation. So what the saliva story is that what is in your saliva is
Mhm.
absolutely a viable way to characterize your patient as it relates to progesterone.
Mhm.
But the test itself has to be sensitive enough and accurate enough. And that's where the question I would ask, which is what we've proven of our test, is simply does it correlate to a high quality serum assay throughout the month of
Mhm.
a group of women? And most people, just being honest, most people who do saliva testing use a test that has not been proven at that level. So the
Okay.
potential is there. It's not that hard, but you just have to choose very carefully. And so you want your lab to be high quality when it comes to that. So sorry for the long winded answer, but
No, no.
yes, progesterone and estrogen in saliva can tell the right story. I mean, even estrogen, if you go back to the older methods that are highly manual, very expensive, but very sensitive, the
Yeah.
serum correlation is actually pretty good. Then people move into these cheaper, easier to do, something that I would be more interested in using because you can use robots and it's easily automated.
Right.
But the data falls apart because you lose about 10x in terms of sensitivity. So and all of that's not very interesting to doctors, right? It's nerdy chemistry
Right.
stuff. But at the end of the day, you want to use a test that's proven, and a lot of them that are on the market simply aren't.
Yeah, I think what's really valuable to us is to have that clinical, expertise based on the knowledge that you just mentioned. So if we know what you just said and have that deep understanding of it, then we can translate that into clinical practice, and that
Right.
is the best thing that we can do for our patients instead of that dogmatic approach of, oh, creams and gels and all the things that I've been taught is what I need to continue